Hello, everyone. Greetings of the day. I'm Sayukta from Radiance with You YouTube channel. And I'm sure all of you must be keeping good health. Today, we are diving into a topic that touches everyone under the sun. We embark on a crucial discussion as we raise awareness about fungal infections and the proactive measures we can take to prevent their spread. Fungal infections might not always be top of mind when we think about healthcare, but they are certainly not to be underestimated. From athlete's foot to nail fungus to more serious conditions like invasive candidiasis, these infections can wreak havoc on our health and well being if left unchecked. But fear not, we are not just here to talk about the problem, we are here to discuss solutions. From simple prevention techniques to the latest advancements in treatment, we'll be diving deep into strategies for combating fungal infections and safeguarding our health, as this is a fungal awareness month. That's why we are thrilled to have Dr. Shetty from Goregaon Mumbai with us today. Dr. Shetty is a dermatologist in Goregaon West Mumbai and has an experience of 51 years in this field. Doctor practices at Dr. Shetty's clinic in Goregaon West Mumbai. He is also a member of Indian Medical Association IMA and Goregaon Medical Association. With an impressive academic background, Dr. Shetty completed his MBBS from Karnataka University in 1970, diploma in dermatology from Grant Medical College and Sir J.J. Hospital, Mumbai in 1972. Dr. Shetty's professional ethos revolves around providing the same level of care he would want for his own family. He understands the profound impact skin conditions can have on mental health and self confidence as well. Expert in his field, Dr. Shetty has services provided by the doctor, our hair loss treatment, anti aging treatments, etc. etc. Thank you so much, Doctor, for joining us today. It's such a pleasure to have you with us.
Pleasure to me also. Thank you.
So, Doctor, today we are going to talk about fungal infections. First of all, we would like to understand what is fungal infection and you know uh, how it is such a chronic skin condition or so worrisome for us.
Fungal infection is so common in India, especially Mumbai. I must say more than 35% of the people are suffering from it. Usually it is caused by a various types of fungi. It's a body, we cannot do anything much about it. They spread in the moist areas of the body like folds of the thigh, under the breast, underarms, scalp, and foot. So actually prevention is the best way than the treatment.
Right.
Once it occurs, patient should take care with medicine as well as with personal hygiene.
As you said, prevention is a major key, and maintaining the hygiene and taking medicines or consulting a good qualified dermat is very important. We would like to understand, Doctor, what are the preventive measures we can take out at home? What are the things that we need to do?
See, first of all, it is very difficult to suggest preventive measures
Hmm.
because also it all depends upon the socio-economic status of the patient. Those who are in Bombay, staying in a single room, 4, 5 members, there is no water, they can't change the clothes and all. For this, first and foremost, you must and should not share your clothes with anybody else and keep yourself clean with daily bath and especially damp areas like genital area and under the breast where while wearing braziers and all those tight things which produces a lot of sweating and food ill-fitting shoes that should be avoided as far as possible. Better use some sandals and see that your underwears, bed sheets, and towels are not used by others, exclusively use and wash it daily and take daily bath, dry the parts, especially genital area, foot and armpits, those who are damp areas. And while using brushes, these are personal hygiene things you should be very careful. When you allow them to use, after using, you just see that you clean it. Secondly, yourself always wash your, of course, see, I say wash every time with soap and water, which is not possible for everybody. But we have to say, wash with your hand with sanitizer and soap and wash. And take care of your nails, which is very important. Fungal infection of nail is very common, especially ladies who are working in the household in the water. And similar methods you have to take care.
Right.
And
Right.
when it becomes more, shall I come to the treatment part?
Yes,
Shall
doctor.
I?
Please. Yeah, yeah, sure.
If it is a mild infection with a single patch of the, then you can treat with local antifungal creams.
Hmm.
When it becomes more, multiple patches and lasting for several days, you must use antifungal oral tablets as well as local. And treatment should continue minimum 4 to 6 weeks. Your doctor may cure you within 10 to 15 days. Still, you should not discontinue the medication at least 4 to 6 weeks.
Mhm.
These
Right.
are the routine things we can say only elite, upper class of society. They will follow this properly. For a poor person with 3, 4 members in
Right.
the family, small house, it's very difficult. But still, we have to say,
Right. So there are basically two things. A, we need to take care of ourselves by maintaining a good hygiene level. B, in case we are still encountering or experiencing fungal infection or any kind of infection, we need to go and consult a qualified dermat
yeah,
so that they can give the medicine, etc. You said that if the patches are not, they are not that troublesome, you can use over-the-counter antifungal creams, right? But at the same time, doctor, would you like to make us aware on what could be the probable disadvantages of using an over-the-counter tropical application for a longer time? Because in our country, because it's so easily accessible, the
yeah,
over-the-counter things. Any advice for that as well?
yeah, I understand. But usually 4 to 6 weeks, you should not use more than that. If you are cured by that time, stop the medication. Or you can continue with the blood check, especially for liver function test and CBC, that is common test, commonly done test. And always you have to rule out diabetes. This
Okay.
fungal infection is usually associated with diabetes. That you have to rule out.
Okay.
And,
Now,
yeah, yeah, after 4 to 6 weeks, usually it responds. If it doesn't respond, you have to continue further with these precautions, doing liver function test and CBC.
mhm. Are there certain environments or activities, doctor, that increase the likelihood of contracting a fungal infection? The environments or activities which can
So
increase.
especially those who are going for gyms with lot of sweating,
Hmm.
sportsmen with lot of sweating, they have to take proper care, especially folds of the thigh and genital area. When it's a damp area, like
Mhm.
folds of the hand, elbow,
Hmm.
such things you have to take care, and they have to take twice daily bath and use dry linen socks and linen underwears, and they should be daily washed, and don't use wet underwears, wet clothes rather.
Right. Now, as you said, that it's just not only the skin, fungal infection can also affect your nails. We have seen fungal infections affecting a person's scalp. So, what are the other areas where fungus can grow and create
Yeah, as I
problems?
told you, this fungus which takes place at the scalp is known as capitis. Other is
Okay.
underarms, under the breast. There. And secondly, body it occurs usually it is known as tinea versicolor, which occurs in the scalp tinea capitis. And what other parts of the tongue, when it affects, we call as tinea corporis. And when it takes place between finger spaces and nail, tinea pedis. And you have to take
Right.
proper care of those things.
Mhm. We have seen recurrence of fungal infection. Once it's treated or it goes away on its own, we have seen it coming back. Why?
That is because of, see, first of all, you should educate the patient importance of taking continuous medication. People usually, when they get little relief, they stop the medication
Hmm.
and it recurs with rigorously. Then we have to continue again. Main thing, proper knowledge of the disease. We should impress the patient, the continuation of the treatment. And sometimes medicine, irregular use of the medicine, medicine becomes resistant to the fungus. Then our treatment fails. And there are no newer drugs. We are just juggling with the same medicine, hydroconazole, ketoconazole, miconazole.
Hmm.
These are the things. Repetition
Oh,
is because of the failed treatment, irregular treatment, and misuse of the drugs.
all right, doctor. We have Sonia Sahu with us, and her question is: how can I tell if my skin rash is due to a fungal infection or something else? So, what are the signs or symptoms?
See, usually fungal infection starts like a small round patch with elevated margins and reddish in color. Single patch. When it becomes multifarious, they join together, they become bigger. Well, I think a experienced person only can diagnose this. What is fungal infection? There is allergies. Second, there is a psoriasis. They all simulate these patches.
Hmm.
Only experienced hand can make out. Common man is difficult because of the sight they can say, ah, this
Hmm.
is fungus.
Thus, it becomes even more important to go and consult a qualified dermat just to check what kind of infection one is
Exactly.
having. Doctor, are there any dietary or lifestyle changes that can help boost the body's immune system to better fight off fungal infection?
Basically, that is the thing. Basically, that is the first thing. But all depends. Understood. Everybody should have, as we say, healthy food,
Hmm.
no irregular food, not all those junk food. This applies to everybody. There is no specific treatment, yeah, food for fungal infection.
Okay. Right. So, a good, healthy lifestyle, healthy
Healthy lifestyle,
eating,
irregular,
of
yeah,
course, it
regular
will
and
help to,
healthy lifestyle.
right. How much time normally it takes for the treatment to work? How much time it takes to treat a fungal infection?
Say all depends. If it is a chronic one, it takes long time, maybe a month also. If it is a newer, just newer one, just started, patient comes early and you give the proper treatment. And if he has not taken over the counter medicines, which is another reason to fail a treatment failure, because many
Mm,
people use steroids. Chemists,
mm,
sorry to say, sometimes just they
right.
give the steroid and patient gets relief, so he is happy. But underlying disease is not cured. His symptoms are little relief. These are the causes usually. So you consult a proper doctor and take his advice and fully follow that advice. Otherwise,
Right.
failures are more. And once drug becomes resistant, you can't help. Patient goes from doctor to doctor.
Right. So, doctor, when a person comes to
They
you
become
with
better. Again, they get it. Again, they come to another doctor. These are the
mm,
things.
Hmm. Many times we also tend to follow our friends or family's prescription who, had fungal infection or any kind of infection. So the bottom line is that we need to consult a doctor in case we are having any kind of infection, be it fungal or any other infection. Second, we need to trust our doctor and follow his or her advice. That's really important. That's what
Yeah,
Dr. Shetty is telling us.
exactly.
Right.
Exactly.
Doctor,
And
when
all
a
that depends
patient
upon the
comes
social
to you,
things.
yeah.
Yeah.
So, doctor, when
I,
a patient comes to you, what is the way of diagnosing? Just by physical examination, you can say that it is a fungal infection, or you also conduct some
hardly we
tests.
go for any laboratory investigation. It's only by inspection,
Hmm.
nothing else. Usually we don't do tests. At the moment test money we do that diabetes. Usually it is associated with diabetes.
Okay. Now, there
Yeah.
are, especially with skin infections, so many myths and misconceptions surrounded. So, are there this relevant with fungal infections as well? Are people, following myths or misconceptions regarding fungal infections as well?
Oh, sorry, I didn't follow you.
Many times, my question is, are there any misconceptions or myths surrounding fungal infections that you would like to address? Many
I,
times, patients come that.
absolutely, absolutely. Misconception is not there. Nowadays, every people out of 10,
Hmm,
8 know what is this, what is it, but they are not ready to follow that schedule.
hmm,
Everybody knows fungal infection. Yeah, yeah, Gujarati, they call the other, yeah, call this, all those languages, they know it, but only they don't follow the instruction and line of treatment.
hmm, right. So, doctor, before we wind up, any take-home message, do's or don'ts in case of fungal infection before we wind up the session? What would be your message for our viewers?
Nothing, as I told, once you are diagnosed with fungal infection, you have to take care so that it should help you as well as others. You should not spread others. So take care of your personal hygiene, clothing, towels, whatever it is. Keep it follow. That's the one. There's nothing. And for a line of treatment, as per doctor's advice, please complete the line.
Right. Right. Thank you
Right?
so very much, Dr. T.
Thank
Shetty,
you very
for
much.
your
And
valuable time, sir. It was a very informative session for
it's a
our
pleasure.
viewers.
It's a pleasure.
Thank you very much, Doctor.
Yeah.
And we really look forward for many more such sessions for our viewers in coming times with you.
Oh,
So this information is issued in public interest by makers of Lullaby Lotion Advanced Gens, a division of Hetero Healthcare. Thank
yeah.
you, viewers, for your participation in today's session. Stay connected to our channel and do not forget to subscribe our channel
Yeah.
Radiance with you. Thank you so very much. Have a great day ahead.
Okay. Okay. Pleasure. Pleasure. Okay.
Thank you, doctor, for giving your
Thank,
valuable time.
thank you. Thank you. Thank you. Oh, okay. 20 minutes. Okay.